All right, everybody, we are going to be working on Dr. Popovsky's masseters. This is a really great treatment for slimming the face, and also when people have bruxism and they're grinding their teeth and getting headaches, wonderful treatment for that. So important things to do that I like to do when I'm setting up somebody to inject is I like to draw a line. I use a white eyeliner for this, and I draw a line from their earlobe to the corner of their mouth, and then I have them clench down for me really hard, bite. And I mark the very front of this muscle, and I feel in the back, and I mark on the very back of this muscle. So you don't want to be injecting outside of these lines because we have nerves that we need to worry about, and also we have muscles that connect to the corner of the mouth that come over right in front of this masseter muscle. If we inject in the first 1 centimeter of this masseter, we potentially can affect their ability to lift and pull in their smile. I have done that to myself. You look really weird. So you really want to focus on injecting in this posterior 2/3.
Don't do that to me.
I won't do that to you, I promise.
This is my fellow, so she better not do that to me.
I'm keeping her safe and looking gorgeous, right? So normal doses can be between 10 units and 40 units per side. Obviously, people with big, thick, strong masseters need higher doses. I tend to like to start people at 10 to 15 just to see how they do and how they feel. Most often you're going to have to push towards at least 20 to really get an effect. Some people come back in 2 weeks and say there's absolutely no difference, and there is going to be absolutely no difference in 2 weeks because, as we know, muscles take a long time to start to atrophy. You break your arm and it takes months for those muscles to start to atrophy. So same thing with this big muscle here is we need to let it sit in there for probably about at least 2 to 3 months to see how much slimming of this muscle we can get. So I like to do 3 separate injection points. So I like to do one here, kind of 2 right on top of each other, and then one a little bit further back. And when you inject them, you want to go deep into the muscle. So you're going to feel a little bit of a pop when you inject this needle. If you inject superficially, you're just going to dissolve this medication kind of up in the upper parts of the skin, and it's not going to sink down to where it needs to go. There's a nice big fascia over this muscle that it's really not going to sink into. So you really need to we use these insulin syringes. You want to go to the hub of the needle. You want to go all the way in, and you'll feel a little bit of a pop when you get into the muscle. So you go all the way in, inject your medicine. So we're going to do 3 points of 5 units in each of these areas. So 15 total per side for starting for her. We may need to do 20 or 25, but I like to do this to start with, have them let it sit for 3 months and see how that does. Probably in the first month, they'll start to notice a decrease in their clenching. It doesn't affect how they chew, how they bite, how they eat, but slowly can either help slim the face or help with that teeth grinding. So that's how we do masseters.